All right, so benefits of CBD oil. We're going to just jump right in here. Actually, I'm going to give you my medical disclaimer. So I'm not a physician, not a doctor. I can't tell you to stop your medication. If you ask me, later, I've got this, this, and this. We can sit down and do an appointment, and I can go through your medication list. And then my rule is, if I don't start medication anyways, because I'm not a physician. But the physician that did start your medication, they're the ones that are going to be responsible for helping you taper off of that. And come on in. It's like church. We got the front row. It's the only thing that's left here. It's hard to get as many people in here. So again, with that, it's one of those things where I can give you general recommendations and guidelines, but it's really going to be ultimately up to your physician. If he or she has questions for me, certainly, pass along my name and number. I'm willing to work with any physician in where CBD oil can be helpful, and then helping to titrate off of whatever that medication is. I will say we do a lot of titrations here. Just as some examples, we make a lot of suspensions with just a multitude of different medications, antidepressants, anti-anxiety medications. I have a new patient that we started on a titration off of Cymbalta, another one on Zyprexa. So a lot of these medications that we're going to be talking about tonight, in general, they're very hard to taper off of, and there's a multitude of reasons for that. A lot of them are just side effect related. So with our compounding, we can really titrate that dose down by 5% every couple of weeks to really minimize those withdrawal side effects. So again, I'm not your physician, but I'll certainly help and facilitate between you and your doctor. All right, so there's a lot. I'm sure you're all here tonight to gain some more knowledge on CBD oil, and there's a lot of misinformation out there, so hopefully I can clear that up. So some basic questions here. So is hemp psychoactive? And the answer is no. I'll get more into that. Cannabis is, and we'll make that distinction here in just a moment. Hemp and marijuana are in the cannabis family. That's true. So that makes them the same. No. We'll get into that in just a minute. Do I need a medical marijuana card to buy hemp extract with CBD? So I just had a patient 2 hours ago that was a resident in Michigan. She had to carry a card with her. But this is regarding hemp extract with CBD. No, you don't need a medical card. We'll get into that as well. The plant chemicals are identical in marijuana and hemp. This is pretty confusing because it's the same species. But again, are the plant chemicals identical with marijuana plant and a hemp plant? Again, the answer is going to be no. So we'll get into that. All right, so chemical structures, this is important. So my approach on this talk, I could spend days talking about CBD oil and so forth, but in the hour and a half that we have together, I'm going to look at it from the pharmacist perspective on the pharmacology, side effects, dosing. That's where I'm going to take you in the next hour here. So here's THC. So here's the chemical structure. Not that we're going to write this down. I'm not going to quiz you on this. I had to learn all this in chemistry and at Madison. But here's the chemical structure. For THC, that's the psychoactive component of marijuana. Here's the chemical structure for CBD. That's the activity is coming from this particular structure. That's your cannabidiol. Again, they look almost identical, right? There's a couple of different changes here. You've got a bond between two carbons here on the THC, and you don't here. You have an alcohol group. So again, very similar in structure, but as you'll see tonight, very different chemistry. So that is important to understand. The best analogy that I have to compare marijuana versus hemp, for those of you that know the pharmacy, we do a lot of bioidentical hormones here. Here's estradiol, the main estrogen female hormone in the body, and here's the main hormone for men, testosterone. Again, almost identical structure. You have an alcohol group on the estradiol versus a double bonded oxygen, and then you've got an added methyl group. And we know, somebody tell me that men and women are the same. I mean, that's like saying THC and hemp or CBD is the same. completely different. So hopefully I just remember those structures. Again, there's very slight differences, completely different pharmacology. We're comparing men and women here when we're comparing THC and CBD. So yes, they look almost the same, completely different outcomes. So, beating a dead horse, same thing. I just threw this slide in about an hour ago. I was just kind of thinking through my presentation from last week. Our own body makes something called anandamide, which this is the chemical. There's different variations of anandamide. I'm going to use that term very loosely, but that's basically our body's own production of a CBD oil-like chemical. So I just threw this in here at the beginning just because I had these chemical structures up front. So just keep that in mind. Our own body produces these structures. That's all I want you to take away from that slide right there. So hemp versus marijuana. We'll keep going through this just a little bit further here. Both are cannabis, coming from the same similar plant, I should say, and can contain phytocannabinoids. So what does that mean? So again, humans produce endocannabinoids, which are endogenous. They're very similar to what CBD oil is, or cannabidiol. We produce, again, anandamides. So we produce these internal cannabinoids. They play a role in the immune system and in the CNS, so in the brain function of the body. Hemp's phytocannabinoids work within our own body's endocannabinoid system. A lot of terms here. What does that mean? So we call it the ECS. Our body, from our brain down to our toes, basically, well, maybe brain down to our gut, we'll say, we'll stop there, has a network of receptors, and we'll get into that in one or two slides here. But we have this built-in receptor network that CBD oil and or THC will attach to. And then depending on where it's attaching to, we're going to have a different outcome, a different effect. So again, we're using CBD oil basically in our own body's receptors that are already present there. So that's important to take away too. We're working with our body's own internal receptor system, basically in the immune system and in the brain. Important point, and I'll get to this further down about the legality system, but just to bring this up sooner than later, marijuana has greater than 0.3% THC. Actually, it has much greater than that. It's more around 10, 20, 30%, depending on what particular, they hybridize these plants. Can get different percentages, but in general, marijuana greater than 0.3%, that's an important number to know. Along those same lines, hemp, so when we're selling CBD oil legally in Wisconsin, that hemp oil has to have less than 0.3% THC. It is important, in my opinion, doing all the research on this talk, is that when you look at the hemp plant, depends who you talk to, but there's anywhere up to 80 different cannabinoids in the hemp plant that has, and the part we're trying to still figure out is what type of effects do these other cannabinoids have. We know cannabidiol, CBD, has a lot of different medical benefits, and we're going to go through that for the next probably 30 minutes here. But it is important. I think there's a synergistic effect of having a small amount of THC in the CBD oil to enhance the CBD oil's effect, its effectiveness. So there was a seminar that a webinar that I was listening to a few months ago that was looking at a pure pharmacological synthetic CBD. So it was 100% cannabidiol, and it was showing how well that CBD oil, or that synthetic CBD oil, was at minimizing tumors, at shrinking tumors in the brain. It was just profound studies that this doctor was doing in Europe, but it didn't have it had zero THC. It was a synthetic analog. So it's still effective, but again, there's some slight differences here in products. I think in general it is important to have a small amount of that THC in the product that you're taking, in most cases. I am going to touch on the hemp extract versus the hemp seed oil. So those are different products. So you got to be careful on what you're buying out there, because again, these terms tend to get thrown around incorrectly. So hemp seed oil and hemp extract oil are the same. That is no to that. Hemp seed oil and hemp extract contain similar phytocannabinoids. The answer to that is, again, no, if my clicker will work. There we go. Both are made from the same parts of the hemp plant. The answer to that is also no. So be careful on what you're buying. You don't want hemp seed oil. You don't want that. At least not for the pharmacological effects we're going to be talking about tonight. There's different properties for that. So hemp and marijuana are the same plant? No. I just mentioned that 5 minutes ago. So yes, they both come from the same species. Men and women are the same species, right? But again, completely different based on that different chemistry. Hemp oil will get you high. No, it won't. We just talked about that as well too. The hemp oil that is legally sold, I emphasize legally, is that THC content has to be less than 0.3%. Hemp oil is only used for epilepsy. There's a lot of information on hemp oil helping with epilepsy and seizures, but as we'll see here in just a few moments, there is a lot of other pharmacology and benefit for CBD, for cannabidiol. All right, so let's get into some of the chemistry here and the pharmacology. So cannabidiol, or CBD oil, I'm going to use those terms interchangeably, interact with, again, our own internal receptor system in our body. We all have this. And there's also other target receptors too that are important to know about. We'll get to those in a few more slides. Again, our internal network of receptors plays a variety of roles in psychological processes, appetite, pain, anxiety, mood, and memory. So when we start looking at the pharmacology of CBD oil, these are some of the categories that we're going to be using this for, or potentially using this for. So there's two main receptors within our body that CBD oil attaches to. There's the CB1 and CB2 receptors. The CB1 receptors are mainly in the brain. So there are different parts of the brain, the hippocampus, the cortex, cerebellum. Whereas with CB2 receptors, those are mainly found in our immune system, in our white blood cells. There's also some CB2 receptors in bone tissue. So again, when I start looking at CBD oil, this is where I'm going to start looking at possible patients of benefiting from CBD oil. Somebody with, possibly poor bone tissue, osteoporosis possibly, we can look at that. Again, there's a lot of information on CBD with neurological benefits as well too. Even though it's CBD oil's main receptor activity is really, again, CB2, not so much the CB1. And then there is both receptors in our skin, in the brain, again, liver, bone. So throughout the body, previous research thought that there was little to no CB2 receptors in the brain. They are finding different areas of the brain that do have the receptor, the CB2 subtype receptor. So we're still learning more information about the internal endocannabinoid system. The important thing here, I use a lot of analogies with like the lock and key and how drugs work in the body and so forth. But the difference here that I'm finding with hemp oil or with CBD oil, it's not really a lock and key mechanism. It's really, what did I call it here? It's more modulation is the way I would describe how CBD oil works in the body. It interacts with both CB1 and CB2, again, mainly CB2, but it's not a lock and key type of mechanism, at least, what I'm, again, big picture wise that I'm seeing. CBD oil does block, it says the endogenous enzyme responsible for metabolism of anandamides. Again, that's our own body's production, basically, of the equivalent of CBD oil, if you will. And hemp oil blocks the enzyme that breaks down our own production of anandamide. So how does that benefit? We'll get into that down the road here in just a minute. So it has a modulation of the receptor, but it also helps to slow down our body's own destruction of anandamide. So it can upregulate our immune system, can help with a whole host of different issues in the body. So there's, again, when we think of receptors in the body for CBD, again, the main ones are CB1 and CB2, mainly CB2. There are other receptors that hemp oil attaches to and modulates. So I'm sure most of you know about serotonin. This is when you look at antidepressants that are out there. It's like Prozac, fluoxetine. There's a whole list of them out there. Can't think of them all right now. But those types of medications, you've got one neuron in your brain that is sending a signal, the other one that's picking it up. And those antidepressants are basically pushing that serotonin and allowing it to just continue that potentiation of that, let's call it that happy mood, electrical charge, if you will. Antidepressants keep that rolling. So CBD actually has a similar effect. There's different pharmacology there that I won't get into tonight, but it's interesting that when you look at some of the studies with CBD, it's modulating this serotonin receptor. So you can find effects in mood, appetite, sleep patterns, pain perception. So when you get into using CBD, here's some of the patients that will come in or having certain issues. They might be on a medication for one of these issues. CBD oil can work in that patient, not through the CB2 receptor, but actually through the serotonin receptor. So you've got to be careful with that because you can have a conflict with, here's a drug interaction. Somebody might be on an SSRI, an antidepressant, like a Prozac, and you might be giving them CBD oil. That may not be the best combination, so we have to be careful with that. Or if that same patient is on anti-anxiety medication, where again, CBD oil in and of itself is a great anxiolytic. It helps with anxiety and reducing anxiety, but we got to be careful. Maybe that receptor is already taken up by another drug, and you're going to try to put CBD oil on top of that. You might not have a favorable outcome, so we got to be careful with that. But it is interesting that CBD oil is attaching to other receptors other than its main network of receptors. So again, here's the structure for CBD or hemp oil. Here's a structure of 5-HTP. So when you look at 5-HTP and serotonin, this is what gets metabolized down into serotonin. A lot of times we sell, it should be back here somewhere, I can't find it. But we sell pure 5-HTP in a capsule form. That's coming into the system. That would be a nice synergistic effect, in my opinion, when you're looking at helping a patient with, again, mood or appetite, poor sleep. To me, it makes sense to start combining something like 5-HTP and CBD oil, because that would give a synergistic effect, or it could give a synergistic effect. Another receptor that CBD attaches to is, this is the TRPV1, not that that's important, but this is the receptor that capsaicin attaches to. When you put like capsaicin cream on topically, it's found in the peripheral nervous system. It's involved with pain, inflammation, body temperature, thought to help patients with rheumatoid arthritis. So it binds to that receptor and stimulates that particular receptor, which then in turn helps with pain relief. This is G protein receptor 5. This is found in the cerebellum in the brain. This activity, so if you activate this G protein, it can lead to osteoporosis, cancer, and obesity. In this case, CBD oil is coming in and being an antagonist, so it's slowing that down. It's blocking that receptor from being activated. So instead of a patient that has osteoporosis or cancer or obesity, in this particular pharmacology, CBD oil is actually putting the brakes on this particular receptor. So in some cases, that receptor is being activated or modulated or changed in some way. In this particular instance, that receptor is actually being blocked. It's antagonizing it, slowing it down, so it can then slow down the osteoporosis effect, slowing down the cancer effect, and so forth. And then the GABA A receptor. So the issue, I get this call probably once a week saying that I'm on gabapentin, so I can't take GABA. So GABA is a neurotransmitter in the brain that is, I consider it the brake system of the brain. So if somebody can't sleep, they have anxiety, nervousness, I am going to, we sell GABA in a bottle. This would be something I would absolutely love to combine with CBD oil because this would have a synergistic effect. So let's keep going here. So GABA is again, calming neurotransmitter. I think of it as the brake system of the brain. CBD oil interacts or increases the affinity of GABA to its target receptor. So let's say a patient comes in and they're already on GABA and it's really not working, or it's maybe working 50%. Should they up the dose, or should they maybe take CBD oil and enhance the effect of something they're already taking and get that additive synergistic effect? I would argue they should add the CBD oil. Again, it's thought to, so CBD is thought to change the shape of the receptor of the docking site instead of, again, that lock and key analogy that we often use. What CBD oil is just enhancing our own body's network of receptors and making the original material, the GABA, work even better. All right. Let's see here. So CBD and safety, we can talk a lot about that, but I got some general points here. It's non-toxic. It does not induce food intake changes. It doesn't increase or decrease appetite. I did talk about obesity, but that's in a different mechanism. It does not affect the heart rate, nor the blood pressure, or transit time. It does not affect psychomotor or psychological functions either. CBD oil does not get you high, even though there's less than 0.3% THC in there. So that's important to know that. Some things you do have to be aware of is contaminants. So hemp, the hemp plant itself likes to basically, I think of it as a mop. It just sucks up everything out of the soil and holds on to it. So heavy metals, pesticides, herbicides. It is terribly important that the hemp plant is grown in clean soil. That is very, very important. The certificate of analysis that I get with the products that we sell show all of that it has all the heavy metals listed on there, pesticides, herbicides. So when you're going out there and purchasing hemp oil or CBD oil, that's one of the main things. There's really three main things you want to be looking at: is the potency of the product, and there should actually be a listing of the amount of CBD or the cannabidiol that's in that particular product. And you also want to make sure, not that this is going to be on the label, but whoever is selling that product to you, they need to convince you and prove to you that there's no heavy metals or pesticides or anything other contaminants in that particular product. So I get a certificate of analysis, which is basically a chemical blueprint of the product that proves that to me. Molds, aflatoxins, so you just want to make sure that you're getting, again, a clean product. There is a lot of material out there that I don't think is abides by all of that. The nice thing about CBD oil is the side effects is very short profile. Dry mouth and drowsiness are really the two main issues with CBD oil. So if you get the drowsiness effect, I'm going to have that patient take it at night. In general, I'm going to recommend actually CBD oil taken in the morning or midday, because CBD oil, it has this natural anti-anxiety effect, and it increases our mood, and that in turn it gives that patient that feeling of energy. So it's going to be typically dosed in the morning. You can dose it twice a day, and I'll get to that later. Drug interactions, there's a lot. So going back to my medical disclaimer on slide 2, you really have to be careful. You can't just take CBD oil and not change, or get approval by your physician with the other medications you're taking. Cannabidiol is metabolized by the same liver enzymes that basically metabolize, I'm making up a number here, but probably 90% of the pharmaceuticals out there. There's a whole list of what they call CYP450 enzymes in the liver that metabolize just a multitude of different pharmaceuticals that are out there. So you have to be very careful with that. Anti-epileptics, if I can say that right, and anticoagulation medication. Those are my two main categories. I want to make sure that patients, if they're on them, it's not that you can't take CBD oil, but you're going to have to decrease your dose, and your doctor's going to have to work with you on getting your warfarin dose changed, or if it's your Plavix dose, your antiplatelet medication. We got to be very careful with that, because that'll change the kinetics of again, anti-epileptics and anticoagulants. And then as far as dosage form goes, the dose of CBD itself, there's all kinds of different variables here that we have to consider. Genetics of the patient, of course, as well. Time of dose compared to the pharmaceutical. So if you're going to take CBD oil, we've got to look at everything that's going on in that patient and make sure that, yeah, they can take CBD oil, but we're going to have to possibly make some modifications to the medications that they're on, or the timing might have to be changed. Consult your prescriber. So again, I can't be that I can be that conduit between you and your doctor and help with making recommendations for those changes, but ultimately it's going to have to come down to the physician that's prescribing that medication for you and what they're going to want to do with that.
Can I ask a question? Do you find doctors that are against this?
We've just got into this arena a short time ago, and so I haven't gotten any pushback yet. I'm sure I will, but we'll cross that bridge when we get to it.
Is there sufficient studies out there that could quantify the CBD?
Yes, very, very much so. So I talked about how CBD oil can enhance the effects of GABA for helping with, and it is a natural anti-anxiety supplement. But CBD oil, hemp oil, can actually be enhanced itself as well. Anytime you take CBD oil, or the capsules for that matter, you want to make sure you're taking it with lipids, either MCT oil, which is medium chain triglyceride oil, which we sell, I think, in our keto section, or olive oil, or coconut oil is basically MCT oil. So you always want to make sure you're getting your lipids with your CBD oil. That's important. It'll enhance the endogenous CB1, CB2 receptors. Take omega-3 fatty acids. So my general recommendation for omega-3 fatty acids is at least 2 grams of fish oil a day, if not 4 grams of fish oil. But as a bare minimum, I'm always going to recommend patients taking at least 2 grams a day, which is basically equivalent to 2 capsules of the Orthomega that we sell here. That gives you about 1,600, a little over 1,600. So I kind of round that up. That'll be close enough for you. Not quite 2,000, but it'll get you there. When you're taking CBD oil, like the products that we sell already in coconut oil or olive oil, they're going to increase the sublingual absorption by at least 2.5-fold. So you want to stack the cards in your favor. Take your CBD, even if you're just taking the powdered capsule, taking it with some type of lipid, some type of fats. Tips on proper dosing. Last week I got a little bit off track on dosing, so that's why I made this little quarter sheet, which is important. I'll get to that in just a minute. But in general, most patients are going to start out with about 10 to 15 milligrams per day. They're going to increase by 10 or 15 every 3rd or 4th day. When using the liquid, make sure you're holding it in your mouth for at least 3 minutes before swallowing. So that's also important too. When you take in CBD, generally speaking, you're going to get, when you do it sublingually, you're going to get better than 90% of that dose absorbed, if not the whole thing actually. When you take that same dose and you swallow it, you're going to get at best probably about 50 to 75%. So, as you know, again, if you those of you that have been using CBD oil already, or if you've purchased it already, generally speaking, it's not a cheap thing to buy. It is expensive. At least at this point, there's not a lot of competition out there yet. I'm sure that price will come down as there's more competition, of course. But again, stack the cards in your favor. Hold that dose in your mouth for even as long as you can. You're going to maximize the benefit, to yourself. Once you're done holding it there for 3 minutes, swish it around. You can swallow it, and it's fine.
Is that a taste that we don't mind?
The taste, well, there's one that we sell that's just in an olive oil, which I've tasted them all. I don't mind it, but they do make one that's a chocolate mint, and that one's delicious. Yeah. Yeah, be careful with that. Yeah. Average patient, and this is very general, but average dosing for most patients is 30 to 50 milligrams a day. So on that little quarter sheet that I handed out, actually I'm just going to grab this. So let's see here. 2 squirts is equal to 10 milligrams in general. With the formulations that we have, when I say 2 squirts, the standard formulation that we're selling right now is roughly, dependent on, there's a couple of different variations to that, but I'm making the numbers easy for myself tonight. It's 10 milligrams is 2 squirts. There is a concentrated formulation that's over there, and 2 squirts would actually be 80 milligrams. That's the advanced formula. It's 8 times as potent as the standard, so we got to be careful. And if you're getting CBD oil, you've got to turn the packaging around. You actually have to look at the supplement facts and see how many milligrams of CBD are in 1 milliliter of oil. So that's important to know that. So again, typically 2 squirts for the standard formulation is 10 milligrams. So you're going to have to be doing anywhere from 6 to 10 droppers per day, potentially. Some of the medical literature that's out there that I reviewed, typical max is 100. I've seen some studies that are that used 200, 300, 400 milligrams of CBD per day. Again, that's the exception, not the rule, but there's some research being done on very high dose. The issue with dosing, though, that I do want to stress tonight is this issue of creating tolerance. So what I mean by that is when the body takes in CBD and you're taking in 10 milligrams and then you wait 3 days and then you're going to take 20 and so on and so forth, you're going to get to this point where your symptoms are almost not even there. They're non-existent. But you don't know that. And you're going to say, oh, I'm feeling so great. I want to feel even better. So the next, you're going to do that for 3 days. And then you're going to bump it up another 10 milligrams. And then you're going to start feeling crummy again. And what's happening is you're flooding that receptor to a point where that receptor is actually drawing itself back into the cell. And that's what I call, and we see that all the time with the hormone therapy that we do here. I think I used the example last week of the typical male at age 25 is producing anywhere from 5 to 8 milligrams of testosterone a day. Do you know what the average dose of testosterone for a man that goes out of this pharmacy is? 100. They feel great for 3 weeks or maybe even 3 months, and then they come back and they start feeling crummy again. And they tell that to their doctor, and their doctor says, oh, maybe 100 is not enough. Maybe you need 200. It makes no sense. You're flooding the receptor. That receptor is actually drawing within the cell. It's receptor tolerance. You make sure you got to be careful with that. Dosing is so critical with CBD oil. I can't stress that enough. Less is more. It's not more is more. All right, now we're going to get into some medical benefits here. All right, chronic pain. So the top 3 reasons a patient usually will come in for CBD oil is going to be pain, anxiety, can't sleep, and probably I would put on there some type of depression, that kind of thing as well. With chronic pain, it depends on exactly, again, each individual is going to be different here, but topical use, the CBD will stimulate the CB2 receptors, and that's going to block the release of inflammatory signaling. Not that I had a few patients come up to me last week about, well, should I use CBD just for an inflammatory response? And my answer would be no. I have 10 other things in my toolbox that I'd recommend for just an inflammatory issue before I'd recommend CBD oil. There's things like skull cap and quercetin, and there's a whole list of things that I'd recommend. If you're looking at large areas of pain, let's just take a fibromyalgia patient, for example, I would use sublingual CBD oil. If it's a patient that just has a particular joint pain, then I'm going to recommend the topical over the sublingual. But large areas, again, I'm more of a fibromyalgia type of patient, I'm going to go sublingual. And again, helps to modify the perception of pain in the central nervous system as well. Research has demonstrated that up to 30% less of traditional medications are needed when a patient goes on CBD oil and is dosed properly. So if we have a patient that is continually needing more and more, the Vicodins or the Oxycontins of the world, there's actually studies out there showing that if you take that patient and actually add CBD oil to that patient, you can reduce the amount of their narcotic pain medication by up to 30%, which doesn't seem like a big number, but that's huge. If you can reduce the amount of pain medication that patient is on, still keep them pain-free, guess what happens when somebody gets a reduction by 30% of their pain medication? A lot of those side effects go away, the constipation and so forth, the drowsiness, all of those side effects at least can be minimized. We're moving the patient in the right direction, in my opinion. Not keep giving them more and more. This was a research article on anti-anxiety. CBD clearly suggests it has an anxiolytic effect, especially in patients with social anxiety disorder. What these authors concluded, though, in this study is that future trials are certainly needed with different anxiety orders. Social anxiety disorder obviously is just one little subset here, but in general, I think CBD oil plays a great job at the patient with anxiety. Migraines and headaches, I wouldn't typically recommend CBD oil for somebody with migraines or headaches, to be honest with you. Maybe more of a chronic issue, I would. There wasn't a lot of convincing studies that I looked at where CBD was just this very effective treatment. Patients with the aura often, that would precede a migraine, that particular patient did benefit more with CBD oil. Typical dosing for migraines, headaches, 10 milligrams. In this case, the research was splitting up the dose, so 10 milligrams 3 times a day sublingually. But again, not recommended for acute situations. So you can still keep the little bottle of Tylenol in your purse, kind of thing, or in your car. For nausea and vomiting, CBD, in this case, is activating the CB1 receptor, and again, is down-regulating that nausea vomiting response. Be very cautious here, though. Obviously, with nausea and vomiting, we want to find out what's precipitating that. We want to make sure we're getting a proper diagnosis from a doctor. If we're just, there's, chronic nausea and vomiting, there's usually something, unfortunately, more severe underlying that's causing that issue. So you got to be careful with that. If you've ruled out all the other possible issues going on there, typical dosing that was in the research is anywhere from 3 to 30 milligrams. I think that was it. And I would do that sublingually. Insomnia, again, there was mixed reviews on insomnia. Yes, a lot of patients use CBD oil for insomnia, but they're usually not taking it right before they go to bed. They're going to take it either in the morning or even midday because it just enhances their mood. They feel more relaxed, but then they're able to fall asleep more effectively at night. I didn't have dosing on that, though. I would typically, again, follow that little quarter sheet that I handed out. Start at 10 milligrams, work up from there. Anxiety, Psd, and stress. So the hippocampus of the brain is involved with memory storage, memory processing. It's involved with the regulation of the HPA axis. And again, there's many CB1 receptors in the hippocampus. However, there is current research showing that CB2 receptors are in there as well, and that's where CBD oil's coming in, the cannabidiols coming in and helping with a lot of the Psd, the stress, anxiety. Dosing for this is going to be for 10 milligrams to start, and that would be sublingually, increasing every third or fourth day. This I would go a little bit slower, push it out every fourth day instead of every third day. If you get into that acute situation, you could do, I would call more of a loading dose of a little bit higher of 20 to 60 milligrams. Not that that always works, but you could try it. For psychosis and schizophrenia, there's quite a bit of actually studies with CBD oil, and it basically, when you look at THC can exacerbate these issues for sure with paranoia and so forth. CBD oil can be taken to help reduce that issue. Again, more studies are needed really to assess CBD for its long-term effect in schizophrenia. So again, there's more and more research needed, in my opinion, in this category for sure. Dosing, generally speaking, 20 to 60 milligrams. So you can kind of see the trend here where we're, as far as the dosing goes. The one thing that was interesting with the research on schizophrenia and for psychosis is there's a lot of talk about adding omega-3 fatty acids. So we know, basically, I always think of the brain in simplistic terms here, but of 6 to 8 pounds of fat with the electrical system running through it. So with fish oil, with omega-3 fatty acids of EPA and DHEA, we have better fluidity and better mental health outcomes. Neurodegenerative disease, Alzheimer's, Parkinson's, Huntington's. There's, again, several studies showing potential benefit. And this is nice because this is showing the potential to reduce progression of disease by CB2 receptor response. So there are immune cells in the brain, and when we get into CBD oil getting into the brain, it's really working on the immune cells and helping to reduce that neural inflammation, which is just fascinating. So there's definitely a role for I think CBD in treating this type of patient for sure. Dosing, when you look at the medical literature that's out there now currently, there's a big net, so to speak. I mean, you can see anywhere from 30 milligrams up to 300. So you really got to work with your provider in seeing what dose would be appropriate for that particular issue. There's over 20 years of research studies showing potential with CBD oil in stopping cancer growth, melanoma, brain, breast cancer. Cannabinoids may also offset chemical toxicity from medication. So if somebody's on chemotherapy, obviously working with your physician, if you got nausea, vomiting, side effects from other medications that patient might be on during their cancer treatment, might be worth having that conversation with the doctor of using CBD oil. Self-medicating is ill-advised. I mean, if you're having nausea, vomiting, or some kind of issue going on, let's make sure we're doing the right thing here first. And then, again, adding omega-3, EPA, DHEA is really going to enhance, again, our own internal network of CB1 and CB2 receptors. So, again, stack the cards in your favor. If you're going to go out and take CBD oil, make sure you're taking at least 2 grams of fish oil a day, is my opinion. All right, we're going to change gears for a little bit. All right, so looking for product selection, some of the important things we want to keep in mind, I touched on these, reading the supplement facts panel on the back of the bottle, actually looking at how much cannabidiol is in that particular product. You should be looking for a total milligram of hemp oil, and then you should be looking at the second line below that, looking for the amount of CBD in that particular product as well. It should be amount of milligrams per serving. In one of the packages that are over there, it's the amount, it's listed, and I don't know why they did this, but in the standard formulation, they have a serving size as 1 milliliter, which is 10 milligrams, that's their standard. But when you get to their advanced formulation, it's 42 milligrams, but the serving size is a half a milliliter. I don't know why they did that, but you got to be careful again look at the dosing for sure. You don't want to start off taking a half a mil, which would be 40 milligrams of the advanced, and you could already be right off the bat getting into receptor tolerance, you know, and that would not be a good place to start at all. You might have benefits for a week or two, but I would argue you're going to be feeling symptoms return real quick. And then again, in Wisconsin, THC content must be less than 0.3%. You wouldn't really know that unless you're working with a reputable company that's selling this.
Can I ask you a quick question?
Yep.
So if you get to that receptor
Tolerance?
how would you back off?
Just go back down by the previous dose. So you go back down by 10,
Okay.
and that's your sweet spot. Again, in general, you're looking for a non-GMO hemp. You're looking for organically grown, FDA-registered facility. For it to be sold, for me to buy it, I can't buy it unless it's approved by the FDA, plain and simple. I could buy it, but it wouldn't do me any good. I'd be in jail relatively soon. You want to make sure the company is following a third-party testing under GMPs, under good manufacturing practices. So again, the company that I went with, you know, I asked them for the blueprint of their particular lot. Show me that the heavy metals, the pesticides, all of these contaminants aren't in there, and then tell me the CBD oil, what's in there exactly, and then also tell me the amount of THC that's in there, so you can prove to me that it's less than 0.3%. And again, I mentioned this already, but the C of A, the certificate of analysis, that blueprint of that particular product, you want that to ensure potency and purity of the product that you're taking, meeting passing federal standards on that. So proper dosage form. So there's a lot of different forms out there. I carry just I carry the three of them: the sublingual, the capsules, and the topical. Most patients, I'm going to argue, is going to use a sublingual. You're going to get the biggest bang for your buck. Again, you're going to get 90% or greater of that material absorbed right underneath the tongue in the mouth. Capsules are fine, except for this issue, the first pass effect. So when you swallow that capsule, that whole dose is going to end up going through your liver before it circulates throughout your whole entire body. And so you're going to lose about half of that dose. So why do that? You can, with capsules, you can get a longer coverage per se, but for most patients, you could just dose the sublingual liquid later on in the day as well, as long as it doesn't keep you up. So there's not, in my opinion, there's not too many advantages of doing the capsules. I think one example would be as a patient that's having a lot of pain at night, and they're having breakthrough pain at night, and that liquid's just not carrying them through. You can have more of a sustained effect with the capsules at night, so that might be one application. Topical cream, I mentioned before, just more of a local effect on a particular joint or area of the body. I had one patient that was using the balm, the hemp balm for rotator cuff surgery. She had some pain, a little bit of inflammation. That was helpful. Suppositories. We don't carry these. I could certainly compound them, but great for Crohn's disease or for menstrual cramping. So you could do a rectal suppository, a vaginal suppository. I didn't see any of those out there on the market, but I could certainly make those. I think I touched on this already, but just to reiterate it again, you know, the Farm Bill, this was signed by President Obama in 2014, I believe. So really this gives the FDA oversight on farmers able to grow hemp, but then they're going to be testing that product, that plant, so that the THC content is less than 0.3%. No cross-reactivity in THC and drug testing. I think I probably get a patient every day that comes in and asks me about that. So if you still fail your drug test, you can't blame me. Okay, so Echinacea. Why am I talking about Echinacea? So I think Echinacea dovetails in really well with CBD oil, and here's why. So we talked about the CB1 and CB2 receptors, where they're located. Again, CB2 is more immune system, the spleen, and so forth. Echinacea alkamides mainly bind to the CB2 receptor, so that's interesting. And so we could take, and here's, I think you have a picture of this. So here's, what is it, Echinacea alkamide? It's basically this chemical right here. You could see how this structure is very similar to our own endogenous production of anandamide, which is this structure right above it. And if you think back to that third or fourth slide about the structures of CBD, this structure can actually kind of move around and change shapes. But once it does that, it can modulate that CB2 receptor and have a positive outcome for the patient. So echinacea is really neat to dovetail in with CBD, in my opinion, for immune effects, immune enhancing effects. And just in general, echinacea also helps with stress in the HPA axis, with regulation in mood. And then the endocannabinoids that are involved in the HPA axis, regulation via fast feedback loop, are also involved. So it's really enhancing our body's own endocannabinoid system. All right. In summary, I think I'm getting down to the end here. Just to kind of go full circle here. So CBD is not THC. Women are not men. Just think of it that way. Completely different. Just based on estradiol and testosterone. CBD does, again, in my opinion, CBD does not bind in general in most cases, but rather interacts with CB1 and CB2. Again, mainly CB2, but it's more of an interaction and a modulation, and then enhancing our body's own anandamide in doing the effect and turning that kind of lock and key analogy that we use. Proper patient dosing and form is critical to success. We got to make sure we're taking the right dose. And is it sublingual? Is it capsules? Is it topical? And then again, the omega-3s. When you look at this big picture-wise, the omega-3 fatty acids really enhance. If I can go back to that, the receptor from, this is actually a depiction of the CB2 receptor. Omega-3 fatty acids really enhance that receptor and make that receptor work better. Allow our endogenous, our own production of anandamide to dock into that receptor and cause the positive outcomes that we're looking for. So I have yet another reason to tell you to take fish oil, if there wasn't enough, right? And again, purchase from a reputable manufacturer. Hemp just will suck all of the contaminants out of the soil. And you've got to be careful that where that plant is grown, you could have positive health outcomes taking CBD oil, but at the same time, you don't want to be sucking in a bunch of heavy metals and pesticides from the product that you're taking. So we want to make sure it's clean. Final thought. So those of you that have been to the pharmacy before, we compound, and you may already know this, we compound a drug called naltrexone, low-dose naltrexone. It's used for a multitude of different reasons, mainly for Lyme disease, autoimmune disease, chronic infection. We have one patient that's been on it since I've been here, 6-7 years, that has kept him from having prostate surgery. He has prostate, or a BPH basically, and prostate cancer, or pre-cancer, I guess I'd call it. So LDN can be used for a multitude of different reasons. And there's a lot of similar chemistry in my opinion, between CBD and LDN. I think that would be a very good synergistic effect for somebody that has, say, an autoimmune disease or chronic infection. Both of these chemicals, they really modulate or activation or blockade. They're not really docking and doing a lock and key analogy. They're helping our own internal system work better is the best way I would describe it. So with low-dose naltrexone, it upregulates our body's own production of endorphins, and that's what then turns into the health benefit of upregulating our immune system. And that's the similar way that CBD oil works. So it'd be fascinating to look at, or have some studies out there with combining these two medications, or supplements, however you want to describe them. There's that. I think that's it, yep. So I ran through that pretty quick. I know, what time am I at now? About an hour.